Atrial fibrillation, also known as AF or AFib, can be described as arrhythmia, a condition in which the heart beats with an irregular rhythm that leads to heart-related issues such as blood clots, stroke, and heart failure. Normally, your atria beat at a consecutively regular pace. They receive an electrical impulse from the SA node, contract, and send the electrical impulse through the rest of the cardioconduction system so the ventricles contract. In patients with AFib, the SA node, which functions as the pacemaker of the heart, is overridden by random electrical impulses in the atrial myocardium. The atria only partially contract due to the flood of electrical impulses. This causes the atria to quiver and shake as if they are convulsing rather than rhythmically beating. Only a select few electrical impulses from the atria will travel through the cardiac conduction system and cause ventricular contraction. Therefore, the ventricles contract at a less frequent rate than the atria.
About 1 in 200 people aged 50 to 60 will experience AF. That number jumps to 1 in 10 people over the age of 80. The most common cause of AFib is high blood pressure because it places a strain on the myocardium and forces it to pump with more force to produce the same amount of blood flow. Other common causes for AFib include heart and lung complications, an overactive thyroid gland, and overconsumption of alcohol and caffeine. Only about 10% of those diagnosed with AFib will be diagnosed with lone AFib. This means there is no direct cause for their symptoms. Most patients with AFib will experience a greatly increased heart rate, which decreases myocardial efficiency. Smaller amounts of blood leave the heart per pump, which decreases cardiac output and causes stasis in the veins. Stasis is blood pooling that makes it more difficult for blood to return to the heart. The risks associated with AFib include blood clotting, stroke, and heart failure.
Increased blood clotting increases your risk of stroke. About 15 to 20% of those who experience strokes have been diagnosed with AFib. Small blood clots can form in AFib patients' heart chambers, travel through their circulatory systems, get caught in small blood vessels, and cut off blood supply beyond the clot's sticking point. If blood supply to the brain is cut off, a stroke will occur. Most AF patients take blood thinning medication to help prevent the formation of blood clots altogether. There are 4 common types of AFib. Their symptoms are similar, but they vary in duration. In paroxysmal fibrillation, the heart returns to its normal rhythm within 7 days. In persistent AFib, medical intervention is needed for the heart to return to normalcy. Symptoms usually last over 7 days. In long-standing AFib, the heart is consistently arrhythmatic for over 12 months. In permanent AFib, the patient decides with his doctor to terminate all treatment for the condition. Treatment for AFib includes heart rate control, rhythm control, and anticoagulation treatment. Heart rate control decreases elevated heart rate. Rhythm control controls cardioversion, converts arrhythmatic heart rate to a regular heart rhythm. And anticoagulation treatment decreases blood